Hi, everybody. My name is Shira Reiner, and I'm a cord blood bank nurse, and we are continuing on our journey about stem cells. So, talking about stem cells today, Doctor, how are you?
Hello, I'm fine, thank you. Thank you for inviting me back. My name is Dr. Alex Melhuish. I'm the medical director at Vitalia 24.
And today we are discussing exosomes, and I'm going to start with the burning question that we started discussing earlier. Are exosomes stem cell therapy?
That's a very good question. Exosomes are found in or are produced by many cells, but in particular, the exosomes that we use for treatment are derived directly from stem cells themselves. And in fact, when we treat patients with stem cells, part of the reason why the treatment is successful is the fact that the stem cells are producing exosomes themselves to regulate and to remodulate the environment of the cells themselves. I think the question you've asked is quite a deep question. Is it the chicken or the egg kind of thing? Without exosomes, there wouldn't be effective stem cell therapy, because part of the reason why stem cell therapy is so effective is the fact that they produce exosomes themselves. So, is exosome stem cell therapy? Technically not, because it's not actually a cellular therapy. It's a therapy based on products of the cell itself.
So, maybe for our viewers, explain a little bit what are exosomes?
Think of it this way: exosomes are these tiny, 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 nano-sized extracellular vesicles. In other words, think of them like beach balls, but tiny, tiny beach balls. And within each beach ball, it contains proteins, lipids, microRNAs. All of these are finely tuned to modulate the surrounding behavior of the recipient cells around them. So they're like a small people with big dictaphones shouting, "Go left, go right. You die, you live. You start producing this type of protein. You downregulate your histamine production." So stem cells themselves are aircraft carriers, and exosomes are the fighter jets. So in cases like this, when we want to treat patients in a setting where it's not physically viable for them to come, for example, travel abroad to receive live mesenchymal stem cells. One way of providing treatment for patients like this is to provide them with the exosomes themselves, because exosomes are a lot more shelf stable, so to speak. So they retain their potency, they retain their cellular activity, even when stored under normal conditions. For example, we can even turn exosomes into a special powdered form or dried form. It's called lyophilized, where we take the unnecessary water component from the material and just leave the intact proteins that make up the exosome itself. And once we rehydrate this, they're active, potent exosomes once more. So there are different ways of using exosomes, which allow us to provide stem cell treatments without the necessity for traveling to a different country, for example. So it's quite an exciting
Yes.
application.
So I'm being asked quite often, can exosome treatment on its own be substituting a whole MSC or other kind of stem cell treatment? Is it a substitute or is it maybe a partial treatment or a supportive treatment? What would it look like?
It's definitely not a substitute. It's quite a viable treatment, depending, of course, on the patient diagnosis and the patient's condition or situation as it is. We would suggest treatments based on that. There are patients where we would say IV exosomes and IV stem cells would be the strongest therapeutic outcome. But of course, some of these patients find it difficult to travel, or traveling itself may be possible, but they don't have the support or the family or friend support for them at that time to travel with them, because traveling alone is also difficult, especially when you have a chronic illness or chronic disease. In cases like this, we've shown the patient has shown great improvement just by using exosomes themselves. So I would not say it's a replacement therapy. I would not say it's a supplement therapy. It's definitely it stands on its own legs.
So if I have a patient that cannot travel for some reason, I can still use exosomes. I can have them shipped to the patient or have somebody pick them up for a patient from a clinic, and they
Yes.
can be treated at home in their own environment. How? How can I use exosomes at home?
Part of the reason why we have seen exosome treatments increase is because that now, thanks to the new method and technologies of not only farming, storage, and preservation of exosomes themselves, but also we see that we can use inhalation or intranasal modes of administration. Both modes can be done at home. There's no invasive procedure. There's no intravenous cannula. There's no IV access needed. For example, some of our patients are using intranasal exosomes at the moment on a daily basis. Their treatment protocols vary, of course, but for example, we have some ALS patients in the UK and also in Europe at the moment, which are doing the intranasal exosomes. Their improvements are quite evident. They're quite dramatic in two of the five patients. So we see that it is a viable treatment and it's a very easy treatment to do at home. One other treatment mode or administration mode that we've seen to be particularly effective and easy to implement, especially with children, is not the intranasal but the inhalation route of administration. Inhalation using a nebulizing machine. So some of
Same
us
like
that
you
have
would
children,
for asthma or maybe a runny
exactly.
nose.
Exactly. It's that kind of machine where you pour the a specific amount of the diluted exosomes into the nebulizing cannula itself, the mask, and then it becomes a fine mist. Part of the reason why exosomes themselves can be used both intranasally and in a mist form is because of their size. They're about 30 to 150 nanometers in diameter. So think of it like a strand of hair, a hundredth of that width of that
So
strand
a
of
strand of
hair.
hair. Hang on, I'll do a
Yes,
strand of hair. Here we go. A
I
strand.
don't
You
have
can't
any.
even see
So
it. Can't even
yes,
see it on the camera. A strand of
a,
hair.
a, a hundredth of that, a hundredth of that is about the size of the nanometer. Is
Wow.
about the size of the exosome itself, and this is why they're so successful in making nebulized or nasal mist. Because, for example, our nasal mister has a very specially designed nasal nozzle to ensure that we're looking at every time between 80 to 125 nanometer particle size for the spray itself. So a lot of work has gone into perfecting the administration of exosomes, both intranasally and inhalation wise. And we've seen the benefits at home with patients using this treatment.
So let's say I want to buy from you exosomes. How will I be getting them? So what would it look like physically? What do I have to do to prepare them? And bear in mind, I'm a nurse. I've prepared some medicines in my life, but most people are not nurses and doctors, and they are scared.
Yes, yes. Um, Now, considering the supply of the exosomes, first of all, as with all medical treatments, uh, you'll have to be evaluated. Is it suitable for you? Would it be of any benefit to you? It's very easy just to say, sure. here's a package, or here's 5 exosomes, 10 exosomes. But again, it's down to is it suitable for the patient? Is it viable for the patient? Will there be any benefit for the patient? We know that there'll be no harm. We know that there'll be no side effects. So we need to just ask those three main questions. In cases where we believe that exosome treatment would not be of any great benefit. This is again is explained during our teleconsultations or our telemeetings, and in some cases, in very few cases, even after explanation for the really serious neurodegenerative diseases, for example, where I guess people are grabbing for hope for anything and everything. In cases like this, we do explain to them that it's not a cure. It may not help in because it's so advanced. Um, so in patients where we do see that it would be very beneficial to do treatment. In cases like this, depending on the disease itself or the patient themselves, we decide on the treatment protocol. For example, for ASD patients, we have seen inhalation therapy, inhalation modality of treatment to be very, very effective, just as effective as intranasal. But the process of inhalation is a lot easier for children for most children. I don't know. I have two children. One likes the mask, one doesn't. But this again is patient specific. For example, if this is just for example, if we have a patient that has been suggested to do inhalation administration of exosomes. Um, they would be provided with, I don't have anything here, but visually speaking, they would be provided with the medicine itself in a special powdered form, and a second empty, sterile vial
Container.
with a self healing lock on the top. Uh, all they'll have to do is provide themselves with sterile saline solution and a couple of needles and injectors, and then we provide quite a simplified, I would say, IKEA form, but graphical and colored instruction manual. But more importantly, once the patient has received the exosomes, on the day of receiving it or on the evening of receiving it, we have already arranged a teleconsultation with one of the medical team to go over not only the treatment, the bottles, the medicine themselves, but also how to administer, how to store, how to keep any kind of problems that may arise. But again, it's as simple. I know for us to say it's as simple as this, but really it's as simple as taking a needle, taking out some fluid, some sterile fluid, placing it into the bottle, giving it a stir like this. Don't shake. A stir like this, and then taking out what you need every day and storing it in the fridge. Again, the bottle is a sterile sealed bottle with a very special one-way seal, so the needle can go in, take the fluid out, and when the needle comes out, it self-heals the top. So the risk of contamination is extremely low.
How many
I would
units
say,
like
I would
that I
say,
can
out of the
buy?
patients that we've treated so far, that we've provided the instruction manual, the video, and also the face-to-face on day teleconsultation, we've had no problems. It is daunting. It is daunting when you see a medical bottle and a medical vial, and you go, "What am I going to do with these two things?" But it's I would say it's as simple as taking water from a water bottle and putting it into another bottle, giving it a
Sure.
agitation, not shaking, but just turning it around like this until the white powder is dissolved, and then taking another needle and taking out what you need. It will be 4 to 5 mils. It'll all be in the instructions, and then entering that into the mask of the nebulizer, and then you're good to go. I know it's easier to say than to do. Put it that way.
I'm
So
sure that
uh,
with correct instructions, people, if you can make scrambled eggs, you can make
yes.
exosomes.
Put it
Uh,
this way, it's not even scrambled eggs, it's toast. It's
it's
taking
toast.
out
So
of the
it depends
packet
on who you
and
are.
putting it into the machine. Oh yes. Yeah, it depends where you are.
How many units of exosomes can one person purchase?
That would be a question based on the medical suggestion. But put it this way, I think the question would be asked, how many exosome units are necessary for treatment? I'd like to
For that
answer that question.
patient.
But we use 7 billion exosomes per treatment cycle, and the treatment cycle lasts for 5 days. Inhalation, depending on the patient and depending on the situation, there'll always be a gap of 7 days to 1 month, depending on what our treatment aims are during the protocol. Where again it will be repeated. Most of our patients receive a 1 year or 6 month package for treatment, which will consist of either two vials of exosomes for the 6 month treatment, or four for the 1 year treatment, with inhalation treatment being provided every 2 to 3 months. Of course, depending on the patient themselves, we've had patients, for example, ALS patients that are having their treatment, one exosome, one inhalation treatment over 1 week, followed by a gap of 2 weeks, followed by another treatment. So again, it depends on what our therapeutic outcomes are, and also on the patient. But for what we've seen based on the cumulative evidence of our past treatments, in, for example, ASD patients or ASD children, we will be looking at one inhalation treatment or 1 week of inhalation treatment every 2 to 3 months.
So that would be quite a lot of inhalation processes for that particular child, but done at home.
Done at home. I mean, it's about 5 to 10 minutes a day with the mask once a day.
So this is
It,
something that parents should know in advance, maybe
yeah.
practice at home with maybe just saline with the child. And then when they feel confident that their child can do something like this, stand, with the mask for 5, 10 minutes a day, then start protocol. Because otherwise you buy this very expensive medication and then you don't get to actually use it because it's being spilled, it's being unused, it's being whatever. Um, can autistic children use both inhalation and nasal spray? So can I buy this material and put it into nasal spray because I saw my child cannot do inhalation for some reason?
You both modes of administration are viable, and you can mix and match. Um, Using the lyophilized exosomes for nasal is more than possible. It's how it's formed anyway. But the problem is the is the nasal adapter at the top, the spray. I'm just using this random bottle all the time, but it's been very good for me. As we know, nasal sprays, they some nasal sprays give a very fine mist. Some nasal sprays give a very droplet form or a watery form. Uh, and that is because of the actual nozzle itself at the end, depending on how small the droplets are. We have on based on not only scientific evidence but on actual using and measuring how much exosomes comes out of each spray itself. We've come to a specific range and type of nasal applicator, which is the most therapeutically efficient for us. In the cases like this, we won't be able to say to someone, just add the water and then put it into a nasal spray and use it. We can't say that because we don't know what size the nasal spray head nozzle, sorry, can make the droplets, which then affects how well the administration of medicine is.
So if I'm not sure, let's say I want to purchase it for my child and I'm not
Yeah.
sure that he can do mask therapy.
Yes.
Should I ask you in advance to include also a spray bottle made by the company to use for that specific reason? So if I try one inhalation and I see it's not working, can I transfer the remainder of the material into a spray bottle produced by the same company? So what they would use to do spray application, for example. Is it
Yes. I mean that's. It's more than possible. Yes.
But
Again,
I
the
have
only
to say in
limiting.
advance. I have to say
Yes.
so in advance.
Oh yes, the only limiting factor is the spray nozzle itself, the actual applicator. I mean, otherwise it can be done. You can take the liquid form, the exosomes, and do it either inhalation or nasal. The only limiting factor is if you don't have a nebulizing machine, for example, you can't do nebulizer. If you don't have the correct aperture of the nozzle head on the spray top, then again, it's not an effective administration.
Okay. So just to recap everything that we talked
Yeah.
about today.
Yeah.
One, do not do exosome treatment without consultation. It's very basic.
I
Um,
mean, don't do any type of treatment or any type of
yes.
medicine. I come from a culture where the next door neighbor says, I spoke with my other neighbor and his mum uses this medicine. I've started using it because it's good for him or good for her. So I've seen a lot where people just think, well, I'll just give my credit card details and I'll buy 6 bottles. I mean, it doesn't work that way. You need to be evaluated beforehand. You need to discuss it. Not every application, not every type of application is suitable for every patient. So, again, at the end of the day, it's a medically driven decision that is a personal choice by the family or the patient themselves.
Okay. Second very important issue, please let the doctors know nasal spray or inhalation. It's important to practice, especially with a young child. Sometimes even with adults, you see that they have some breathing issues, and so their breathing is very labor intensive. Maybe it's better to go with a spray bottle. And if you need a spray bottle, this is a one-time use issue, so you cannot recycle these. Once the spray is finished, it is finished. You need a new bottle. So if you think your child needs more than one application, more than one cycle, you need to have more than one spray bottle. It's important. Learning how to mix is very simple, but like making a cocktail, all you have to know is what you put where and when, and your clinic will guide the parents how to do so. And of course, know what you are doing always. If you know how to store it properly, you can buy more than one cycle, of course, using all the equipment that you provide and whatever you need to buy at home, it shouldn't be so difficult to purchase and use exosomes.
At home, all they'll need is to get a syringe and some sterile fluid, which you can get from a pharmacy or a large hospital.
And of course, exosomes treatment cannot replace full cellular treatment. It is there and
No,
designed to help those who
no,
cannot come to clinic or people who are doing post care at home after full treatment.
exactly.
Thank you very
Yeah.
much, Doctor, for being with us today and for
Thank
this
you.
very important information. If you are interested to get consultation from Dr. Alex and his staff, please contact the link below, leave your details, and the staff members will contact you. Thank you so much for being with us today. We will
Thank
see you
you.
in next episodes.